Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
arterial supply and infarction. So we have the anteroseptal infarction. Anteroseptal infarction is actually it is associated because of the blockade of left anterior descending artery, and it is seen in almost 40 to 50% of cases. There is lateral wall. There is also one more which is called as lateral wall infarction, and it occurs mainly because of the left circumflex artery blockade, which is seen in almost 10 to 15% of the patients. 10 to 15% of the patients. Then we also have one more which is called as 15% of the patients, which is called as inferior wall infarction, and this inferior wall infarction is mainly due to the right coronary artery, and it is seen in 30 to 35% of the patients. Okay.
thank you and thank you for watching.